Hey y'all, and welcome to my channel. On this page, I talk about technology and money. If you're new here, welcome. Please, you're welcome to consider subscribing. And if you're a returning viewer, welcome back. Let's see. Happy New Year to everyone. This is my first video of the new year. Yeah, it is our first video of the new year. So I hope everyone's new year is starting off well. And if you do resolutions or have plans for your new year, I hope everything comes through for you like you want it to. So today I wanted to do a quick video. So today we're going to talk about digital health startups and just around technology and nursing, and again, always impact to nursing practice. Some TikTok trends in healthcare that I've come across, that some healthcare trends on TikTok and conversations that I came across on that platform that are just a little bit concerning. It just goes back to some things I've said about the reach of nurses on social media, the influencer culture, which is not bad. I've been influenced by things on social media, not just TikTok. Influence, like when I was getting out of debt, and I talked about how I paid off all of my debt. How I did that, and just by watching people's videos on like YouTube and Instagram and everything, how that influenced me, with positive behaviors, and how that could be a good thing. And then the last thing, we're going to talk about identity negotiation for Black women in culture in corporate. But I think beyond just that, the identity negotiation for Black women in corporate can also be extended to people of other cultures. So we're going to start with just this very interesting article I came across on the top digital startups based on some research. So I'm going to share my screen. I practiced beforehand, so it should be relatively smooth. We don't want to do that story first. We want to start here. And that should be sharing. And let me just make sure it's sharing. And it is. Okay. So first I'm going to talk about this very interesting article that I came across on Becker's on the 150 most promising digital health companies of 2022, based on a marketing and business analytics firm. So this business analytics firm, they do an annual ranking of the 150 most promising digital health startups. I went to this company's website. They also do analytics and market research for not just healthcare technology, but also fintech or finance technology and other sectors as well. So they've been doing this. They've been doing these rankings here for a while, and so it's really interesting. So Becker says that the listed companies have raised $5.6 billion in financing since 2017. And it talks a little bit about the market, the company that did the research and analytics, what their methodology was in ranking these companies. Because you all know, anytime I look at research, I'm always interested in like the methodology or the metrics used. So for these companies, they're listed in alphabetical order, and I'm not going to name all 150 of them. But what I will point out are just a few that I felt specifically speak to the impact and the changes to nursing practice that are happening right now and will happen in the future. And I always like to pay attention to not only the traditional healthcare model of like health systems and hospitals and surgical centers and things like that, but also what's happening in the digital health space. Because like I've said in the past, and here, let me just stop sharing for a moment. Like I said in the past, especially like with the hospitals and health systems, you're seeing, especially some of the ones I've seen like out on the West Coast, bigger health systems up in like New England, those hospitals and health systems are going from the model of having a chief information officer to having a chief digital officer. And it just speaks that even that, and that's just one subtle change, right? We're seeing there's a lot of different changes, very small happening in healthcare, an extension of that technology, which, will impact not only, how we as nurses practice, but also physicians, pharmacists. Like I did the video last week on how CVS and their expansion into retail healthcare will be changing how pharmacists practice, and with, the continued embracing of like automation, artificial intelligence, and things like that. So let's just take a quick look at these lists of companies, and they're listed alphabetically. And I'm just going to call it like 2 or 3 trends that I just noticed. So you see digital pharmacy, and we have already talked about the change in pharmacy practice. Here's a company, let's see. There is a clinical intelligence. There's one. And again, I've talked about, if you're a nurse at the bedside or a surgical center, just think about clinical intelligence like this. Everything that you do on a patient, especially that you're documenting in an electronic health record, is a data point. And on the back end, somebody is going to want to look at that data and do data visualizations to tell a story, to help improve patient care and things like that. But here's like 2 companies here, Bloom Care. Oops, sorry about that. Bloom Care and Brave Health. Both of them are virtual care. Let's see. Here is a home health and wellness. There's 2 of those. Curity, Dokla. That's a home health and wellness digital startup. Here's another home health and wellness digital startup, Ember Labs. There's Imaging. Imaging has done a lot to embrace digital health and the use of AI. Here's, look at there, back to back. There's 4, 3 virtual care companies, another home health and wellness, another virtual care, Fourier Intelligence. I wonder if they're using analytics. I looked up a couple of these. More virtual care, Jasper Health. I feel like I've heard of them. Heard of that company and seen what they've done. Levi, another virtual care company, or Levy. More virtual care, Neolis, Nuvo Group, virtual care, Nimble Science, home health and wellness, Oath Care, care coordination and collaboration, more virtual care, Recovery One, Renalis or Renalis. And I think, let's see, Summis, Global, Suvera, home health and wellness. The other is virtual care, Thoughtful Virtual Care, Tia, hybrid care, which is interesting because, there's, that whole model that we especially saw an expansion of during the last 3 years, which is, hospitals without walls, hospital at home, Vivante Health, virtual care, Vori Health, hybrid care, Waymark, hybrid care. And I think there's a couple of more. Yep, there's one more, virtual care. And so why am I calling this out? I did a rough count. So out of these 150 companies, I think I noticed about 20 virtual care. Let me just do my quick math right quick. Let's see. Whoops. I think my screen went black. Sorry about that. There we go. All right. So, say if there was 20 virtual care companies out of 150, that's over 10% of those are around that could potentially impact nursing practice. And I looked up one of these. Let's see. I looked up a couple of these. There was one virtual care company that I looked at, and they talked about how, well, first of all, they were hiring. A couple of these were hiring and looking for positions, and some were looking for like registered nurses. I can't remember if it was Bloom Care or another one, but they talked about virtual nursing. I did a whole video around virtual nursing, but as many like home health and wellness digital startups and virtual care companies on here, I think is really important. Again, and I'm not saying all nurses should leave the bedside or leave, ambulatory care, et cetera, to work in tech, but I think it's just really important to just be aware of, the different technologies that are coming, and prepare ourselves as professionals, or either our children, or those who are in our families that may want to go into nursing, just so they understand the integration of technology and its impact to nursing practice is just going to continue to evolve. And as professional nurses, it's our duty to prepare ourselves so we can provide optimal care for patients. And again, as usual with all my references, I'll be sure to leave a link in the description so you all can go check and go check that list out for yourselves. Okay, so the second thing I want to talk about is TikTok trends in healthcare, or TikTok trends in healthcare that I've seen on that platform, and how it's always important for us, anything that, this is the last thing. Sorry, y'all, I'm bouncing around just a little bit. How it's always important, anything that you see online, always do your own due diligence. Anything that I say, any topics that I cover, please never take anything that I say or any other person online and just run with it. Okay, so let's just watch this TikTok that there's this nurse I follow on TikTok. She is a nurse practitioner, and she shared this video of this patient who recently had let me make it clear, make sure you all know I'm not violating any HIPAA. This patient has been sharing her Brazilian butt lift, or BBL, surgery journey on her platform. So she's been talking about what the process is like for her experience, etc. So this is someone who is openly sharing their experience. And so I'll play the TikTok video, and then I'll share just a few final thoughts about just being really careful about the advice that you take from these social media platforms and apply to your own lives. So hopefully you all will be able to hear this okay.
Hey y'all, I just want to give y'all a BBL update. As you can see today, I am a board certified nurse practitioner and a huge advocate for women to do whatever it is to enhance their beauty and make them feel their best self. As a practitioner, if you are my patient or the patient of any practitioner and you are in pain, please tell us. We do not want you to go to street pharmacists. We do not want you to obtain drugs illegally. First of all, it's a crime. And not to be a Karen, but we don't know where the medication that you've got, if it's still even effective, if it's expired. Just come see us and talk to us. We will listen. We will find a solution. And most importantly, we want you to be safe and not be in pain. Love you. Hey y'all.
All right, so I'll leave a link to the original creator's video. It's a couple of minutes long. But essentially, the patient talks about how she's had her BBL surgery and how it's going, but that she has been having a lot of pain and unresolved pain. So instead of telling that to her provider, she went to, as the patient said, quote unquote, a street pharmacist and got some medications. And as that nurse practitioner said in that video, you want to be really careful, because I'm a nurse. That's a nurse practitioner that shared the video and had lots of other nurses, commented on that video. But if someone doesn't have any clinical experience or medical background, or just understand, you really could be putting your own life into danger by obtaining medications from not a licensed practitioner or a certified pharmacist. As a pharmacist, again, you don't know if those medications are expired or what they could be mixed with, or if it's actually what you thought it's supposed to be. And then one thing I thought about when I saw that creator's video, unresolved surgical pain could be unresolved pain from surgery, where you're taking prescribed medications and your pain isn't relieved. Could be an infection. It could be other surgical complications, right? And then, normal everyday consumers may not know that. So I was going to talk about the TikTok trend with the diabetes medication being used for weight loss, and a lot of very popular influencers talking about that and how it has created a shortage of drugs for patients with diabetes. But I've decided not to talk about that because I just feel like the conversation is a little bit more nuanced than I can handle. I just think it's because you're looking at supply chain issues, you're looking at the concerns around obesity, around influencer culture. But just with this patient talking about her BBL and, you know, getting medications from a street pharmacist without, you know, sharing those things with her provider, just always be careful. And, you know, if you're a non-medical person, you know, you watch this or you see those things, talk to your family, talk to your children about that, and just be really careful because influencer culture is so powerful. Like, for example, the new thing I'm seeing on TikTok is those, I think they're called Stanley cups. So you know how people have like their water drinking cups, and I did not know those cups are like $40, but now like people are talking, you know, they're influencing about, you know, these $40 cups and, you know, how drinking water out of them is so great, but it's just a water cup. Okay. So just tell your family, your friends, just be really careful about, you know, picking up on trends, particularly around like healthcare, on like TikTok or, you know, YouTube. I know there are finance, pocket watching with JT. I love his YouTube channel. If you are really wanting to get your money in order for the new year and you don't want to follow like maybe a Dave Ramsey or Susie Orman, pocket watching with JT. He is an accountant out of St. Louis. He comes from a family of accountants. They have their own business. And he talks about on his platform the dangers of people taking finance advice from influencers on social media. And what he does is he pulls videos from like YouTube and TikTok and Instagram and just talks through them and say, you know, how following this advice can get you into tax trouble, right? So it's the same thing with like following, you know, like patients talking about their surgery journeys and things and going to street pharmacists or doing things without telling their providers. Just be careful. Good evening to ACD for Educational Consultant. So glad you're able to tune in, catch a live. Now, one more thing I'm going to talk about is identity negotiation for Black women in culture and corporate. So I came across this topic, which I've worked in corporate for over 19 years and I didn't have a word for, you know, what I had to experience or what maybe my friends had to experience or what my friends experienced as we were acclimating to working in a corporate environment. Let me just make sure my screen is still sharing. Oh, it's not. Yes, I agree. The diabetes meds and weight loss is scary. It is, and it's causing the supply chain issues for patients who need the medication for their diabetes management. But then I also know people need medication for their, you know, obesity management. So I have thoughts about it and I was like, it's a little bit more nuanced. I was like, I better not touch that one. So identity negotiation. I came across this great video from someone over on TikTok. You know, you can learn things. The Clock app is interesting. You got to be careful with what you say, what you consume on there. But it's like YouTube. You know, you can come across. There's some really good business, finance, money, career people on YouTube. Also on TikTok, just doing things in smaller bites, right? So I came across this lady. She does tech and finance and career type videos on her TikTok page. And she talked about the concept of identity negotiation for Black women and who aspire to leadership roles. So I had never heard of identity negotiation. I worked in tech and corporate for almost 20 years. And so I actually had to Google what identity negotiation is, which according to Google, it says it's a process through which people reach agreements regarding who is who in their relationships. And I was like, what? What is that? I was like, what does that mean? So I did one step better. And I was like, well, let me go to like an academic, I like peer reviewed journals and reading things from like peer review journals, because, you know, instead of just Googling something and going to a random website, if you go to like a peer review or a university or academic type outlet, I just find, you know, where it's from like professors, and I just find the information for me just to be a little bit more credible. So I kept Googling and I came across this piece here from University South Florida, where these two professors did a whole journal article on identity negotiation, what it means around like how you identify for yourself and social interaction. I'm just going to read a little bit of what they said in their article, and then I'll share the TikTok video and some final thoughts. So this publication from this journal is from 2008, so I know it's a little bit old, and they say, you know, just be careful when you're looking at data from articles that are older than 5 years. I think with this theory here, we're okay with it being a little bit older. So it says that the process of identity negotiation has several components, one of which includes those self-presentation processes people perform in the service of establishing who they are. Let's see. The process of identity negotiation refers to a much broader set of processes through which people strike a balance between achieving their interaction goals. And again, that TikTok video is going to talk about how this relates to Black women in corporate spaces, and satisfying their identity related goals, such as the needs for agency, communion, and psychological coherence. Let's see. To this end, people generally conform to various principles of identity negotiation that not only facilitate smooth interpersonal interactions, but also promote intrapersonal harmony. And that's why I said at the beginning of this video, yeah, I know the title says identity negotiation for Black women, but to the extension, it could also be applied to like women of other cultures, or men or people of other cultures, that piece around the intra-personal harmony. Let's see. When, for example, people encounter identity discrepant evaluations, are compelled to behave in identity discrepant ways, they may see the experience as offering more support for their identity than it actually does. And it talks a little bit about biases and things like that. But okay, so now I'm going to share this creator's video. And she takes this theory of identity negotiation and apply it to Black women or Black people who aspire to professional leadership roles. And hopefully this plays okay with the volume. Let's make sure it's turned up. And again, it is.
There are going to be so many Black professionals that are going to be pissed about what I'm about to say, but the conversation has to be had. I see this debate between people who come in and say, I'm going to be authentically me, and if an organization can't accept the blackity black me, then I just won't be at that organization. I think that's a great stance to have. But I also want to talk to those people who aspire to leadership. At some point in your career, you're going to have to decide if you want to engage in identity negotiation. And the hard choice is, if you're a true visionary, you understand that like you have to deal with that. Does the ends justify the means, or do the means justify the ends? If I engage in identity negotiation and I advance and I can help bring hundreds of people with me, do I do that? Or do I continue to show up all the way me, even though it means that I'm going to get stuck in the roles that I'm going to get stuck in? I'm going to see a glass ceiling. Those are some choices you're going to have to make, and they're hard choices, and nobody can make them for you. You have to make them for yourself. But anybody who tells you that that is not something that's going to come up as a Black woman in your career, they're lying.
Okay, so let me pause this. Okay, I never had a word when I have conversations with. I have friends who work in corporate like myself. I have mentors who work in corporate who are minorities, and we talk about how you show up. Right? How you show up in an organization and every day, and also how that's perceived and how that can impact negatively or positively your promotability, your how you network, how with your coworkers, like laterally, how you manage up, how you manage down, how you manage, with your stakeholders, and how that's viewed. But I never knew a word of it. I never had a word for it. And so I began thinking about, conversations I've had with my friends and associates who are minorities, and how, in a sense, you have to think about, how you show up, how that's perceived, how you might have to conform, how that makes you feel, right? Because you may feel like you are showing up every day. When you show up to work, you're not showing up as, authentically who you are, and how that can maybe not be a good feeling for you, right? Not saying there's a true answer to say yes, women should not, or people should not engage in identity negotiation. Just when I saw that video and I looked at the definition of what it is, I was like, oh, I've definitely had to do that. I know my friends, and I have family members who are in C-suite positions. I have a cousin who is he was a CIO at a bank. He's been a CTO at a bank. Now he's in another C-suite position at a bank, and we've had conversations, about how we show up, the things we talk about at work, and how that impacts, our interactions with our coworkers, with our leaders, if we're in a management position with the folks that we supervise, right? But just this whole concept of identity notification. So if you are aspiring to a professional role, or if you are in one and you are a Black woman, just to take into consideration what this creator said, and just ask yourself, well, have I engaged in identity negotiation and didn't realize that's what I was doing, and how that has impacted my intrapersonal relationships? Yeah, that was a good one. The clock app, sometimes there's some foolishness on the clock app and some comedy, but I'm telling you, you can learn some things on there. And I'll be sure to leave a link to this creator's this particular video, but also if you're so inclined, check out some of her other videos, because she talks a lot about like corporate and preparing yourself for professional and leadership roles. She has some interesting videos. That's just one of them. So yeah, y'all, that's it. Thanks as always for folks who, if you're watching this from the future and made it this far in the video, please do like this video and consider sharing it with, if you have any friends, whether they're nursing friends or non-nursing friends. Thank you everyone who emails me and also, sends encouraging feedback in email, and positive feedback, and also like recommendations for improvement. It is appreciated. All right, y'all. Again, Happy New Year to everyone, and I will see you in the next video.